We're ready, George.
Okay, we've got Chris Herring, Emergency Medical Services Manager, and Scott Dudley, Behavioral Health Manager, on the line, and we are going to. I understand you guys know everything there is about COVID.
That's what they tell me.
That's what they told me. Anyway, when I asked, what should I talk to these guys about? And they said, anything you want. So let's
know everything that we know about COVID at this very second, but that doesn't mean it won't change in 30 seconds.
Well, Scott, I want to turn to you right off the bat, okay? Because it's an issue that is not overly publicized, but we've been in the pandemic for over a year. This thing, the whole situation, the news, the good news, the bad news, the fluctuating news, has got to be creating a whole lot of stress. And mental health, are you guys taking care of that?
You know, George, it's an amazing scenario that no one could have predicted or anticipated, and it's had some incredible results, both in terms of finding new levels of resilience in our population, in terms of many of us finding different ways to manage, the distress and stress of this epidemic in very positive and supportive ways, and then also finding ways to support people who are struggling with it. And I think on all aspects of that, again, unanticipated, unpredictable, and yet it's coming out. It's going to be really fun to actually get to the point of recovery where we can see where we're at as a population and go forward. So we're already talking about that with students and elderly populations, and yes, indeed, with migrants as well.
And the people who are experiencing stress, are there any recommendations? Are there any cure-alls?
Well, okay, bottom line is we all cope with stress. It's something that's just a human way of doing things. And I think everybody has to kind of ask themselves, is my coping causing any other problems? If it is, we call that in behavioral health, we call that maladaptive coping. And because you don't want to make things worse trying to help yourself. So going to healthy things, going to exercise, going to diet, going to relationships, going to church, going to reading books, everything that you can do that helps you be stronger and healthier, that nurtures you, is good stress coping. And that's always been a part of life, and we've certainly seen it pop up in ways in the pandemic again for unpredictable.
As somebody who experiences stress from now, again, a positive mind helps a lot. Try to keep a positive mind.
It has a lot to do with it. I mean, the part of it is just kind of accepting things as status reality, too. So when stuff's happening, sometimes that stuff's really negative, and it's okay just to embrace that and say, okay, this is not a very good time. How do I keep myself safe and healthy as I manage through this time, and do I need additional supports? So if I'm not sleeping, if I'm not eating, if I'm getting angry, if I'm, doing other things that are potentially unsafe or worse, how do I reach out to people in my community to help me keep safe, whether that's family or church or behavioral health?
And if things turn worse, they can turn to behavioral health, right?
Absolutely. We've seen that, in the pandemic, we had to kind of reposition everything into kind of virtual world. And our caseload originally kind of went down a little bit, but then it stayed pretty steady and it's pretty stable. But we've also done a lot of positive outreach with the Let's Talk About It Express SA radio shows. And so we're really trying to talk to everybody in our community about staying safe, about staying healthy, and about supporting each other.
I was going to mention that, but I was kind of wondering if I should throw a shameless plug for Let's Talk About It. But
my job.
I'm sure it's covered on that show. So it would be well worth listening to, whether you do any other time or not. But during now would be a good time, because there's a lot of good information and it's absolutely free. So you can't beat that. Scott, thank you. Chris, Scott mentioned the fact that we're starting to see a light at the end of the tunnel. Is that accurate?
Everything is looking like we're heading in the right direction, George. Our case rates are down. Our hospitals are doing wonderfully well at this point. As of this morning, we have single-digit hospitalized COVID patients, which we haven't seen since probably March or early April of last year. So we're moving in the right direction. Vaccines are rolling out. Looking at our vaccine dashboard, just right now, as of yesterday, over 55,000 doses of vaccine have been administered throughout the county. So we're moving along pretty well. I think that light, we've seen that light for a long time, but that tunnel's always been really long. So we're getting closer.
And a top news story coming out this morning. They've been talking about it all morning long on the California news. Is Imperial County going to be able to join the rest of the state and open up vaccines to just about everybody by April 15th?
And that's the goal. I think we're still going to see some issues with supplies, but essentially, it'll be open for everybody, and we're just going to keep chipping away as the supplies come in. Our allocations have been kind of creeping up over the past few weeks. Just looking from where we started in December, our first shipment we received was 975 doses. I think this week we got just over 8,900 doses that showed up for the week. So we're slowly getting there, but we're moving along. So
we are showing progress, because I remember that was quite a controversy there for a while, that everybody wanted a vaccine, but there was no vaccine to give them.
And I think we're still going to see some of that. And that's one thing that, coming from the public health side has been enlightening and refreshing to see is how well our community is accepting of this vaccine. Our community generally has pretty high vaccination rates with our routine immunizations, and we're carrying that along through the COVID vaccination process.
And people should also realize that they can do a lot on their own. Just depending and waiting on the county could be, kind of futile. I'm a veteran, and the VA has done a lot giving out vaccines. So, if you want, I had mine. And my friends have had theirs, the VA, through the VA. I have other friends that got it through the CVS pharmacy in San Diego. The CVS pharmacy here sent them to San Diego, got them an appointment, and they got the vaccine that way. So there are other ways to get it instead of just kiting that they're going to go around.
Yeah, and well, first, thank you for your service. But looking at countywide, I know a lot of people turn to the public health department for their vaccinations, but at this point, there's more than 20 vaccine providers in Imperial County who are all administering COVID vaccine. A lot of our providers are in that transition phase, going into the red platform, which really help kind of streamline it for the public and the user on the other end of the MyTurn. You log into MyTurn.com, some basic information about yourself, where you live, up where there's open appointments and providers. So providers get enrolled into that system. It's going to be easier for everybody to find a. And then through that system, there also is a phone number for those who may have challenges in computers and the internet. So there's a phone number that they have access to that same through a state operator.
There you go. So there is a way. If there's a will, there will be a way. Everybody should be able to get their vaccinations by or shortly after April 15th. Is that a good prediction?
I think there's still going to be some supply issues. We've got close to 200,000 people living in Imperial County. I think there's still probably going to be some frustration with trying to get those appointments. But I think as time goes on, that frustration will ease and the availability will be a lot more widespread.
Okay. Changing the subject slightly, the IBC gym recently changed functions. Can you explain what they're doing out there now?
Yeah, I'll jump in on that, George. I know we had the alternative care site out there, which Chris was a huge part of. And we've changed our role, and we've changed our name. It's now the Quarantine and Isolation Shelter at IBC. And so what we're doing out here is we're providing temporary shelter for migrants and asylum seekers that were released from federal detention that have either tested positive for COVID-19 or have been exposed to COVID-19. So we're giving basically humanitarian aid to people who wouldn't have a place to shelter or quarantine to prevent the spread of COVID in our community.
Would that include homeless people too?
Well, we're specifically dealing with migrants that have been released from federal custody.
Okay.
So that is the population that this facility serves.
Now I know
we have other places and ways to manage our homeless community of Imperial Valley residents.
Yeah, but my first thought is always the homeless that, the doctor says, go home and quarantine because you're exposed. And the guy says, yeah, where do I go?
Early in the pandemic, Imperial County established ways to house people who were homeless and COVID positive, or people who had to quarantine, which is a different population, who were homeless. So, okay. And we've been doing that successfully, basically for the duration of this thing.
So there's been a good turnout in
just
that.
A new aspect with migrants.
Yeah. How many migrants are you guys quarantining or have out there at the gym? Is there a significant number?
As of this morning, we have 27, but we've been open a week, so we'll see where that number goes.
Well, that is significantly higher than the number that I heard. It was 3. Yeah, so that was because there was somebody, one of the advocates were talking about that. Anyway, so it's the isolated area is isolated to everybody out at IBC. Don't go out there and try to check it out because they're.
Please and thank you.
Excuse me.
Please and thank you. Don't come out and check it out.
Okay.
Anything else you guys want to add?
George, just to kind of dovetail on the topic of what's going on at IBC campus. And, I've had a couple of these conversations with Carol over the past year as well. One of the things that we really want to stress and emphasize to our community is how well all of your government and non-governmental entities are working together to kind of solve this problem that COVID has brought into our world. Every time a new challenge comes up, it's generally something that our county has dealt with many times in the past, and I've been saying this a lot the last couple of days. Is COVID likes to complicate all the complications we already had. But everybody's done a great job of coming together to develop these programs and solutions to keep moving our community forward. And I think one of our biggest partners and allies throughout this whole response has been the administration and board out at the Imperial Valley College. With a phone call and a couple of meetings, we were able to they were willing to open their doors and turn their gym and some of their buildings over to us to turn it into a hospital and now this quarantine and isolation shelter. They've been great to work with, as well as all of the state and federal agencies that have kind of chipped in along the way. I think it's a testament to our community. We're a small county, don't have a whole lot of resources, but we're all very good at pooling the resources we have together to come up with what needs to happen to serve our community and our residents. And the other piece, just as we move into what's going to be the holiday season, that spring holiday season, we do want to remind our community that it's taken a lot of effort from them. They've put a lot of work into getting us to where we are with this pandemic response, and we just want to remind everybody that it's still a little bit of ways to go to get to the end of this, and we're still going to need the help from the community, to keep practicing social distancing, wearing your mask. Spring break is right around the corner, and we want to remind everybody that if you can cancel that non-essential trip, celebrate at home with your family. Avoid the spring break vacation this year, and hopefully by summertime we're able to put some of this COVID nonsense behind us that we've all had to deal with, and just keep pushing along and have a great summer in air conditioning and move into the fall.
And we are moving forward. It's tremendous that cooperation that you talked about is we are moving forward. There was talk about us being graduating to another tier pretty soon.
Yeah, we're looking at potentially, if we're able to hold the numbers where we are, moving into that orange tier, maybe as soon as next week. That
would be fantastic, wouldn't it?
It would be amazing.
Doesn't the state make that announcement around Tuesday?
Generally, it's Tuesday at noon.
Tuesday at noon. So we will look forward to that.
They'll make the announcements, and then it would be effective Wednesday morning.
There you go. Orange. Orange is the new. That's a TV show, isn't it? Orange is the new something. Anyway, I thank you guys for joining us. It's always interesting, Chris and Dudley, Mr. Dudley. Scott, you guys are very interesting and a lot of good information. Chris Herring with Emergency Medical Services Manager, Scott Dudley, Behavioral Health Manager. Thank you guys very much. And from me to everybody else, you guys are doing a great job.
Thank you, George. It's always a pleasure.
All right, guys. Have a good weekend.
You too.
Yeah.
Thank you. That's it. That is our conversation for this week on the COVID-19 situation in Imperial County.
Imperial County Air Pollution Control District provides you with air quality reports daily. How is your air quality today? Check current air quality conditions in Imperial County at imperialvalleyair.org. You can sign up for free air quality alerts to be delivered directly to your email address, or you can download the Air Quality Alert app to your mobile device today. Stay informed with Imperial County Air Pollution Control District.